Today, I'm sharing 10 simple ways to improve your blood circulation and lower your risk of stroke and heart attack. These are things I personally use every single day. And most importantly, I'll reveal a few common mistakes that are making all your efforts useless without you even realizing it. Have you ever wondered why your legs feel swollen, heavy, or cold? That could be an early warning sign of poor circulation. If you don't take it seriously, it can eventually lead to a stroke or a heart attack. One of the biggest causes? Blood clots. These are basically clumps of platelets stuck inside your vessels, blocking blood flow. Another big issue is arterial stiffness and plaque buildup. Over time, fat and debris clog your arteries so badly that blood can't reach your hands and feet. This leads to swelling, varicose veins, and in serious cases, blood pooling that puts a huge strain on your heart. A lot of people think taking pills is enough. It's not. Medications and supplements only help about 5% of the time. What I'm sharing with you today are methods I've seen work, over and over again with real patients, in real life. Secret number 1, compression therapy. This includes medical-grade compression socks, running sleeves, or support braces. They help push blood back toward the heart, reduce swelling, and most importantly, help lower your risk of stroke or heart attack. Think of blood flow like traffic on a highway. When it gets jammed up, your heart has to push harder. That builds pressure, leading to high blood pressure, chest pain, and over time, serious events like a stroke or cardiac arrest. But here's what most people don't realize. Compression gear isn't for everyone. If you have severe arterial stiffness or plaque buildup, compression can actually make things worse. It might increase pain at night or cause more blockages, which is why some people feel numbness or discomfort after using them. Today, so many of us spend hours sitting, working from home, watching TV, barely moving. It is like being tied up in the old days. When the body couldn't move, fluids built up, and the heart eventually failed. The same thing is happening now. The only difference? You're tied to your sofa instead of a tree. A study in the Annals of Internal Medicine confirmed that compression socks significantly reduce swelling and improve circulation. Here's what I always tell my patients. Start with an over-the-counter pair. Don't jump straight to the crazy prescription ones. Trying to get insurance reimbursement for compression gear is an uphill battle. So start with a simple pair of light compression socks. Look for labels like mild or light compression, usually around 10 to 15 pressure. Avoid going straight for the strong medical-grade ones because they can be too tight and cause more problems. Always start light. Secret number 2 is regular exercise. Sitting too long is killing you. In fact, it's been proven to be even more dangerous than smoking. Studies show that sitting still for over 3 hours causes blood to pool in your lower body, increasing your risk of blood clots, stroke, or heart attack. Since the pandemic, this problem has become extremely common. But here it is the good news. Simply standing up or moving for just 1 or 2 minutes every hour can significantly improve your circulation. Take a short walk every hour. Lift your heels off the ground while sitting. Move your ankles back and forth 10 times. Raise your legs while lying down. Do air cycling in bed, or if you're in a chair, just lift your hips an inch for a few seconds. That alone helps pump blood from your legs back to your heart. Don't stay still for too long. Secret number 3 is strength training. This is something most people overlook, but it's actually more important than walking or jogging. If strength training were a medicine, it would leave every other treatment in the dust. You don't need to lift heavy weights, even if you're 70, 80, or 90. You can start by just sitting in a chair or doing light squats against a wall. Strength training helps open up your blood vessels, increases blood flow, and lowers your risk of stroke and heart attack. It boosts the production of nitric oxide, which relaxes blood vessels and improves circulation. You don't need fancy equipment. Simple movements like air squats or heel raises can make a huge difference. If you train just 2 to 3 times a week, within 3 months, you could gain lean muscle, lose fat, and significantly lower your risk of diabetes, stroke, and heart disease. Nobody's too busy for this. It's the best investment you can make in your health. Secret number 4 is elevating your legs. It's simple, but incredibly effective. If you're dealing with varicose veins, poor circulation, or swelling, try lifting your legs above the level of your heart. A 2015 study showed this one simple action can increase venous blood flow and reduce pressure. Even if you can't exercise, just lying down and elevating your legs a few times a day can create a big improvement. If you work at a desk, I highly recommend using a leg compression device or an inflatable leg pump to keep your blood from pooling. Secret number 5 is massage therapy. Massaging your feet, calves, hips, and thighs doesn't just feel good. It actively stimulates circulation, reduces swelling, and helps prevent blood clots. You can try dry brushing in the morning, use a foot massager, or even a massage gun to release tight spots. Just a few minutes of massage each day can improve your vascular function. The real key isn't expensive equipment, it's being consistent. Secret number 6 is warm water. I'm a huge fan of soaking my feet, or even my whole body, in warm water with Epsom salt. It doesn't just soften skin, it helps reduce inflammation and swelling, which go hand in hand with poor circulation. Soaking in warm water helps break that vicious cycle, giving you relief and improving circulation almost immediately. Secret number 7 is your diet. Poor circulation and heart disease often don't come from aging. They come from eating the wrong way for years. If you're eating too much sugar, fast food, or fried food, your blood can't flow the way it should. You need to cut back on inflammatory foods and start eating foods that support healthy arteries. Focus on key nutrients like omega-3s, magnesium, and vitamin C. Rutin and bromelain are also great for vein health. Eat real, natural foods, leafy greens, citrus fruits, whole grains, and lean meats. I've put together 3 detailed lists of foods that help and hurt your circulation, which I'll share. If you're serious about preventing a stroke or heart attack, start with what you eat, every single day. Secret number 8 is horse chestnut. This is a well-known herbal remedy backed by solid research. It strengthens your veins, reduces swelling, and improves blood flow, especially in your legs. Many people have found real relief using horse chestnut for heavy legs, swollen ankles, and calf pain, all classic signs of poor circulation. Secret number 9, stay hydrated. Even mild dehydration can thicken your blood and slow down your circulation. Drinking enough water helps lower pressure in your veins and keeps your blood flowing smoothly. The easiest way to check is your urine. If it's dark, you're probably dehydrated. One important note, if you have congestive heart failure or kidney disease, talk to your doctor first, as drinking too much water can be harmful. And now, for the most important part, none of these tips will work if you are still holding on to the root causes. Things like smoking, eating refined sugar, carrying excessive weight, or ignoring underlying conditions like diabetes. So start with the real work. Cut the sugar, quit smoking, and lose the extra weight. No magic pill will ever replace what only you can do for yourself. Finally, number 10, lose weight. For every pound you lose, you take about 5 pounds of pressure off your feet with every step. So, if you lose just 8 pounds, that's 40 pounds of pressure off your joints. This won't just help blood circulation. It will reduce the workload on your heart and lower your risk of high blood pressure, stroke, and heart attack. Also, consider that your body might be out of balance from old injuries or wearing the wrong shoes. This can cause one side of your body to overcompensate, leading to pain and poor circulation. That's why getting a basic body assessment is so important. In my next videos, I'll be sharing more simple, powerful ways to improve circulation. So stick around for your health. Thanks for watching, and don't forget to follow and subscribe for more tips.